Let's first take a look at the coronavirus figures in Australia and how they stand at the moment. The number of confirmed cases around the country is now sitting at 5,362. Yesterday, 4 deaths were reported, and that brings the country's total death toll to 28. New South Wales remains the state with the highest number of cases. It rose by 91 yesterday to bring that state's total to 2,389. Although confirmed cases continue to rise in every state, the data does show a downward trend in the rate of infections. The Prime Minister, Scott Morrison, says the country is now in the suppression phase of the virus and that new strict self-isolation measures are expected to be in place for some time. So the news is at least initially good, but certainly the message is don't become complacent. No. Keep doing what we're doing because it seems to be showing some good results.
Absolutely. Well, this is going to be here for quite some time. So whatever action we can take to try to stem the spread of it, it's the best thing that we can do for ourselves, our family and the health workers as well. Now, it has emerged that New South Wales Health allowed the Ruby Princess cruise ship to disembark passengers in Sydney last month. This is despite more than 100 passengers having acute respiratory illnesses. Well, 7 Ruby Princess passengers have died from COVID-19, while more than 600 others are infected. 342 in New South Wales.
For more on this, let's go live now to our reporter Kathleen Ferguson, who joins us now from Sydney. Kathleen, what is the latest on this Ruby Princess cruise ship and the debacle that's surrounding it?
So there has been a lot of attention on the Ruby Princess, and because 2,700 passengers were allowed to disembark in March when testing was incomplete. That was one thing that drew quite a lot of attention to it. Now we have more than 600 people across Australia that have become infected with the coronavirus that have been linked back to the Ruby Princess. And what we've seen from these leaked emails, as you mentioned, is that New South Wales Health actually gave the ship the green light to let those passengers off. The ship insists that it was assessed as being low risk, but we now know that there are about 104 people who had respiratory symptoms, acute respiratory symptoms, and we know that some of those people also tested negative for influenza. And that the Ruby Princess is at the centre of an investigation by police as well at the moment. So I think we can expect some more to come to light on that, but maybe also from some scrutiny on the government's health department as well.
Kathleen, questions aren't only being asked about the Ruby Princess. What's happening with other cruise ships along the New South Wales coast?
Well, as you can probably hear right now, there's quite a bit happening down here. Just behind me, we've got the Spectrum of the Seas, and we've got helicopters. There are boats been circling this cruise ship as well, and these ships are refuelling, being re-provisioned to go back to their home ports tomorrow, as we understand. There's been a lot of pressure on these cruise ships to leave Australian waters, not just in New South Wales, but there was a very strong push from the New South Wales Police Commissioner, Mick Fuller, earlier in the week, basically saying pretty clearly, you need to go home. This could be disastrous if we let these crew members into Australia. That could put a lot of pressure on our medical system. So some of those, about half a dozen we understand, will be leaving. It's unclear whether or not the Ruby Princess will be leaving, and we did hear from Carnival, that's the operator of the Ruby Princess, earlier in the week saying that they needed to be close to Australian shores because people are being medically evacuated. These crew members are coming here for treatment. So by the sounds of things, they're worried that if they get out to sea, they won't have access to that care.
Kathleen Ferguson with the latest there from Sydney. Thank you. Let's head overseas now, and the number of coronavirus-related deaths continues to climb in the United States, with fatalities in New York almost doubling in 3 days.
State officials are warning hospitals could soon be overwhelmed and have issued an urgent plea for more help. Our North America correspondent James Glenday has more from Washington.
They'd like more nurses, more doctors, more personal protective equipment to make sure that those doctors and nurses are going to be able to treat patients unharmed. And most importantly, they'd like extra ventilators as well. They are really in short supply. As you mentioned, a lot of local officials are warning that it might just be a couple of days before hospitals are overwhelmed. There are more than 100,000 confirmed coronavirus cases in New York State alone. There have been nearly 3,000 confirmed deaths. That's about half of all the deaths in the United States. And Governor Andrew Cuomo is warning that he can't access the resources he needs on his own. And he's calling for some sort of national system whereby states that are worst affected at the time get the extra resources that they need from other parts of the country that aren't quite as badly affected as this wave of cases begins to wash over the United States. Here's a little of what the governor had to say.
New York is in crisis. Help New York. And then pick up, decamp, and then go to the next place as this rolls across the country.
Okay, it sounds really dire there in that state. There has been one subject of debate as the death toll continues to climb in the US. And the question is, should Americans be wearing non-surgical masks in public? So are officials any closer to issuing a clear advice on that?
Well, that's a really, really interesting question because we know that the White House is debating this. We know that the top infectious diseases authorities have been pushing for this, effectively urging people to, when they do leave their homes, when they do leave these lockdowns to go and get medicine or groceries, that they wear some sort of face covering, some sort of homemade mask or a cloth mask. They don't want people wearing surgical masks, but they do think that perhaps these more homemade kind of style cotton masks will stop the spread of coronavirus somewhat. Now, that view is, of course, a little bit contentious. Some people don't think that masks work. Some people think that they give people who are wearing them a false sense of security. But just a short time ago, I was chatting to an Australian who's played a really prominent role in pushing this issue to the forefront in the United States. He's a medical data scientist, Jeremy Howard, and he is firmly of the view that if everyone who went outside was to wear some sort of face covering, then the rate of the spread of the coronavirus would be dramatically reduced. And he said that applies to countries right across the world. Here's a little of our conversation.
You've got to. You've absolutely got to. I mean, particularly in Australia, right? Because Australia is coming into winter. So the Southern Hemisphere is going to be in so much trouble here because the Southern Hemisphere are going to be the first to actually see what this thing can do.
Certainly a very interesting point that's going to be debated right around the world. Lastly, James, in the US, a Navy captain has been relieved of his command, as we understand it. And this comes after he was calling for action to curb the spread of coronavirus on board his aircraft carrier. How has he been farewelled?
Yeah, some viewers will remember earlier this week, Brett Crozier, captain of one of the United States' most important aircraft carriers, was over near Guam, and he wrote a letter to his higher-ups demanding that they do more to prevent the spread of the coronavirus on his ship. And as you can probably see and maybe even hear, when he, after he was sacked, as he left the ship, he was given really, I mean, a hero's farewell. The people on board chanted his name, and quite a lot of people have been posting anonymously online saying that he did the right thing and he served very, very honourably indeed. So that little story and that little clip, which you can see right now, is certainly making a lot of headlines here in the United States today.
That's James Glenday reporting there. Across Europe, the daily death tolls paint a sobering picture. Spain recorded another 932 deaths, although that was slightly down on the day before. Italy saw an extra 766 deaths, taking the toll to over 14,500.
The UK recorded its worst daily death count of 684. Buckingham Palace has announced that the Queen will be broadcasting a special address on the crisis tomorrow. Here's Europe correspondent Samantha Hawley.
Here in the UK, the death toll keeps rising. It's now over 3,000, with the highest toll yet of 684 being recorded in the last 24 hours. Boris Johnson still has symptoms of COVID-19, including a temperature, and is still working from home. But on social media, he sent a message to the nation to tell people to stay out of the parks and off the streets on the weekend when the weather is expected to get much warmer.
I just want to say one crucial thing, one quick thing to everybody thinking about this weekend and what may be some fine weather, because I reckon a lot of people will be starting to think that this is all going on for for quite a long time, and they'd rather be getting out there, and particularly if you've got kids in the household, everybody may be getting a bit stir crazy, and there may be just a temptation to get out there, hang out, and start to break the regulations. And I just urge you not to do that. Please, please stick with the guidance now.
A convention centre in East London that's been converted into a hospital is now open. At its capacity, the Nightingale Hospital can hold up to 4,000 coronavirus patients and was built in less than 2 weeks with the help of the military. It received a royal opening with a difference and from a distance.
Now, I was one of the lucky ones to have COVID-19 relatively mildly. And if I may say so, I'm so glad to see the Secretary of State has also recovered. But for some, it will be a much harder journey. I am therefore so relieved that everyone can now have the reassurance that they will receive all the necessary technical care they may need and every chance to return to a normal life. This hospital, therefore, offers us an intensely practical message of hope for those who will need it most at this time of national suffering.
The UK is expected to reach the peak of the virus on Easter Sunday. Buckingham Palace has announced the Queen will address the nation this Sunday from Windsor Castle.
Samantha Hawley with that report. Now, authorities in the blockaded Palestinian enclave of Gaza say the coronavirus is set to devastate a vulnerable population of 2 million people. Middle East correspondent Eric Twarchek has more.
Gaza has few coronavirus test kits and hardly any ventilators. It's also one of the poorest and most densely populated places in the world, already locked down under an Israeli military blockade and tight Egyptian restrictions. But so far, the fact that Gaza was already isolated has actually helped prevent the spread of the virus. There are only a dozen cases, all in special quarantine areas set up for the outbreak. But carelessness and ignorance have already meant some positive cases in quarantine have passed the virus on to others. People in quarantine have told the ABC some centres lack basic protective equipment and the staff are mixing with infected patients. Some staff at one centre contracted the virus after they shared a meal with those infected. That means it's only a matter of time before cases start appearing in the Gaza community. That's worrying because frequent fighting with Israel and a feud between Palestinian factions have left this small enclave with a broken economy and a decrepit health system. Gaza health officials say they couldn't cope before the coronavirus outbreak and they have little hope of managing when it hits.